You know that scene in movies where someone's lying on an operating table, the mask comes down, things get blurry, and the next thing you know, they're waking up saying something completely ridiculous to the nurses? Well, that part's not entirely wrong. But what's actually happening inside your body and brain during anesthesia is way more fascinating, and a lot more carefully controlled than Hollywood ever shows you. Because anesthesia isn't really sleep, and it's definitely not death. It's something in between, a kind of controlled, reversible pause button for your consciousness. Think of it like time travel, except you can only move forward. One moment you're in the operating room, the next, boom, you're awake, and the surgery's done. Anesthesia comes in a few flavors. There's local anesthesia, which numbs just a small area, like when your dentist numbs your gums. Then there's regional anesthesia, which blocks feeling in a larger area, say an arm, leg, or even everything below the waist, like an epidural during childbirth. But the one that gets the most attention, and the one we're talking about today, is general anesthesia. That's the kind that makes you completely unconscious, pain-free, and with zero memory of what happened. If you've ever had it, you know the routine. You're wheeled into a bright room full of machines beeping and people in masks. Someone says, take a few deep breaths and you'll drift off soon, in that calm tone people use when they know what's coming. Maybe you start counting backward from 10, and before you hit 7, it's lights out. But here's where it gets really interesting. While you're out, a whole chain reaction is happening in your body. First, your awareness fades. Your brain stops keeping track of what's around you. Then your memory center, the hippocampus, stops recording new information. Next, your brain's communication networks shut down to outside signals. And your spinal cord and pain pathways are silenced, so even though your body might experience something physically, your brain never gets the message. And the wildest part, you don't actually feel yourself losing consciousness because once it starts happening, there's no consciousness left to feel anything. It's just click, you're gone. Now, anesthesia doesn't simply turn off your brain. It's more like flipping switches in different networks. Drugs like propofol increase the effects of a calming neurotransmitter called GABA, quieting your neurons. Others, like ketamine, block excitatory signals that would normally keep you alert. And opioids like fentanyl intercept pain messages before they even reach your brain. Together, these effects basically disconnect your brain's sensory, traffic control tower, the thalamus, from your conscious cortex. The result? Your perception of reality goes offline. Brain scans show that this state is nothing like normal sleep. When you're asleep, your brain cycles through predictable waves of activity. Under anesthesia, those cycles disappear entirely. It's not sleep, it's a controlled blackout created by chemistry. And through all of this, there's one person keeping you safe, your anesthesiologist or nurse anesthetist. They're not just there to knock you out, they're your life support pilot. While the surgeon operates, they're constantly adjusting your medications, monitoring your oxygen levels, heart rate, and blood pressure, and making sure every vital sign stays right where it should. It's less like pressing a button and more like flying a plane, constant, careful control until you land safely back in consciousness. When it's time to wake up, your brain doesn't just snap back online all at once. Different regions start reconnecting at different speeds. You might feel groggy, a little emotional, or like no time has passed at all. Sometimes people dream vividly or say things they don't remember later, which makes for great stories if you're on the nursing team. So yeah, maybe be extra nice to them before you go under. Is anesthesia dangerous? For most healthy people, not really. Modern anesthesia is incredibly safe. The odds of a serious complication are lower than your risk of getting into a car accident on the way to the hospital. But of course, people with heart, lung, or neurological conditions can have higher risks, and allergic reactions or breathing issues can occasionally happen. And about the myths, no, you're not getting stuck under forever. Unless there's another unrelated medical issue, the drugs wear off and your body and brain return to their normal rhythm. And no, it's not just sleep. It's a unique, reversible shutdown of awareness, something only modern medicine can do. Think about how far we've come. Just 150 years ago, surgeries were done on awake, screaming patients, held down by assistants. Now we can safely pause your pain, memory, and consciousness, and bring you back as if nothing happened. You hand over control of your body to another human being, and they return you safely. That's pretty incredible. So the next time you, or someone you love, need surgery, remember, Going under isn't falling asleep. It's more like letting someone carefully disconnect your mind from reality and then guide you safely back. And if you happen to wake up saying something embarrassing afterward, don't worry. The nurses have heard it all before, and thankfully, HIPAA keeps your secret safe. If you learned something today, hit like, subscribe for more science and medicine stories, and drop a comment about the funniest or weirdest thing you, or someone you know, said after anesthesia. See you next time.